Hey everybody, welcome to Turn the Power On with Dr. Christina. Today I'm going to talk about what animal chiropractic is and what animal chiropractic is not. And I'm going to be reading from a couple incredible information resources that I'm going to put in the comments below after this video as well. I am certified animal chiropractor with the International Veterinary Chiropractic Association, or the IVCA. Okay, they made an incredible canine handout for me, for us doctors, and also equine as well. So I'm going to be reading from a couple of these things to just really share with you what animal chiropractic is. And then they've also created a digital brochure. It's a little different than these, but I have that printed, and I'm also going to be reading from some of that as well to share with you today. I will be able to also share that in the comments below, the link for the digital versions of these. I know some of you love paper. If you want one of these, you can grab one of these at Kraft Chiropractic the next time that you're in, or I can send some to you if you are a vet or a boarding facility or a barn or a dog canine type of facility. I'm working a lot with boarding and grooming facilities to refer me patients, as well as veterinarian clinics, grooming, I said that already. Those types of places are incredible to educate the animal owner. And we're going to go into some things in this episode today that I think are really important, not only for the animal owner, but for the veterinarian and the vet tech that might be listening to this as well. I'm huge about educating my community and not only other professionals in our area who work in the animal industry, whether it's small animal or large animal, or maybe you are a pet owner yourself or a horse owner and you want to know some of this information. It's very important to understand that who you choose to work with your animal needs to be hopefully licensed and professional and has the training to do the work that they say that they're going to do. So I might be busting some myths in this episode today, and I think it's very important that some of those things get explained, and in a very compassionate way, to not to throw anybody under the bus, but it's very important that people who are seeking animal chiropractic, that you're seeking a licensed professional, whether they're a veterinarian or a chiropractor like myself, and we're going to talk about that. So again, 2 brochures, paper, and I also have 2 brochures digitally that I will be reading from. Okay, so what is the IVCA? So I graduated from Options for Animals, College of Animal Chiropractic in February of 2022. This program is postdoctorate only for veterinarians and chiropractors, okay? You have to be a licensed doctor to be able to even obtain this college. You might not have to be practicing before you go off to animal chiropractic school, but you have to have a doctorate degree from a vet medicine school or a chiropractic school. Okay, so first and foremost, the only people that are able to do animal chiropractic in the United States are licensed, graduated veterinarians, doctors of veterinary medicine, and licensed graduated doctors of chiropractic. So that's what I am. So first and foremost, this educational video today is to let people know that I am not a veterinarian, and we're going to talk more about that too. It's important to know that when you do reach out to me, that you are not talking to a veterinarian, that I am a licensed human chiropractor in the state of Minnesota, and I'm also a licensed animal chiropractor in the state of Minnesota. So many of you probably understand that, and some of you that are my patients, I actually live in North Dakota, but I practice in Minnesota because I have the licensure for both human and animal here, and there is not such great animal chiropractic licensure even really available in North Dakota. As a human chiropractor, it's much better for me to practice in Minnesota. Okay, and we'll talk more about that as well as I go along today. I'm very passionate about getting to the root cause of some of my animals' issues, okay? Can chiropractic cure anything? No. Can it help everything? Yes. I have now had 3 years of clinical practice working with canine, feline, equine, and some other farm animals as well. And I have now extensive case study experience and actual experience about how well chiropractic can be of a support modality when appropriately referred by veterinarians, first and foremost, and that we have an understanding of what chiropractic is. And that's what I'm the expert in. I'm the expert in chiropractic. I'm the expert in delivering the adjustment. That's where I like to focus on and really focus on my talk today around, the chiropractic adjustment is much more than us just moving bones around. We're actually freeing up your animal or your human, if you're a human patient of mine, because I'm going to use comparative anatomy a lot with humans and animals. And I think that is really important to understand that we're built a little different than our animals, and we're not going to be adjusted like our animals either. So with that being said, I think the first and foremost, most important thing that I want to talk about today is making sure that you're choosing a licensed professional. And I will talk more about that regarding a few instances recently when I've had some declined referrals from veterinarians. And I have contacted the owners in these cases many times when we do have a declined referral. It's usually because I'm not a veterinarian. And I explain to them it's just their choice to not refer to a chiropractor who's not a vet for animal chiropractic. Though I am certified and licensed to practice on animals, it's just the preference of certain veterinarians won't refer their cases. And I can't explain it. It's just case by case. Sometimes this happens. And basically what happens, you guys, is I have a wait list and we just move on to the next animal that needs me. Okay. There are other options that you can do. There are other animal chiropractors in our facility or in our FM community. There isn't many. So I'm going to offer you other options if I do get a declined referral for your animal and give you the best advice that I can over that phone call or over some type of communication that we might have through an email or even through text messaging. Oftentimes I have to do that as well to communicate with my clients. Okay, let's dive into the International Veterinary Chiropractic Association is based out of Germany. There are two schools of thought for animal chiropractic that are, I would call like the big guns for animal chiropractic. You either have the IVCA certified animal chiropractors, which is what I am, and that's the choice that I chose to make because I went to Options for Animals College of Animal Chiropractic. They offer us to take the exam with the IVCA. I passed that, I'm graduated, and I'm also certified by the IVCA. What that means is every 3 years, I have to have 30 additional continuing education to keep up my certification in animal chiropractic. And Minnesota requires that I take 6 hours every year as well for animal chiropractic licensure. On the human side, it's different. I have to do 20 hours of continuing education every year to maintain my human license. So there's separate continuing education for me that I do and take every year for human and for animal. And to stop on this real quick, last year in September, I was so fortunate to head to Illinois and train with Dr. Jay Kamarick, Dr. Petra Sulwood, and Dr. Clayton was not there. Dr. Jay was, Dr. Ren Bleem. These are the people that are teaching with animalchiropracticce.com. And I went to my very first in-person seminar. I've taken some of their online before. My very first in-person seminar in Galva, Illinois, where we worked on farm animal. So we were shown, and really extensively through the weekend, we worked on birds, chickens. We also worked with show cattle, and we were absolutely, I was blown away. We were actually able to go to actual show cattle barn and work on real show heifers and show steers in northern Illinois. And this is kind of the show capital of the hog world in the United States. So we were in kind of hog nation. So then we also had show hogs come to us, animal chiropractors. Remember, we're both chiropractors and vets that are certified animal chiropractors that were able to attend this after graduating seminar. So postdoctorate seminars we're the only people that can come to this. Is a small group of us. There might have been maybe 25 or 30 of us at this event training to keep up our certifications, to keep up our knowledge on what we're doing, and to improve our skills and to prove our motion palpation skills to the body of the hog, the sheep, the goat, and the cow. So we worked on show cattle, show goats, show sheep, and show cattle. But what was the coolest part for me was to actually, we all rode down the road about 10 miles to an actual, I think it was Cardinal Cattle Company near Kewanee, Illinois. And we were able to actually work on some Angus and Simmental, I believe it was that day. So with that being said, this is a very intense type of work. We work in all conditions. The cold right now has been incredibly hard to make my route work on Monday. So I've had to reschedule a few horse patients and some hogs and things that I've been working on recently to different Mondays. And so, but that's all what's beautiful about being your own boss, is that you can change things and move things around, which I'm really grateful for as well. And it's the International Veterinary Chiropractic Association, let's go back to that, is one school of thought. You can get certified in that wheelhouse. The state of Minnesota loves the fact that I went off to college, got graduated, and with animal chiropractic, as well as my chiropractic degree, which is another 3 1/3 years before that. And I am now licensed because I went to that college. So it's very important to know that not all chiropractors are trained in animal chiropractic. They might be able to help your animal, with activator or with their hands, but if they've not gone to actual animal chiropractic training, that's okay. But just know that I'm not one of those types of chiropractors just practicing on animals. It's very important for me to let you know that I worked my little tail off, and this has been a dream of mine since I've been 16 years old, to have gone to options and to have IVC certification, to then actually hold a license and do this work as a licensed professional in the state of Minnesota. And I don't adjust in North Dakota, though I live there. And if I travel in North Dakota, I do not adjust in North Dakota. I only adjust animals in my Moorhead clinic here, and I have a route for the large animal, which includes cattle, hogs, sheep, goats, horses, from Fertile to Fergus Falls right now. That's pretty much my max area. Fertile to Fergus Falls is about a 100-mile stretch between Polk, Norman, Clay, Becker, Wilkin, and Ottertail counties in Minnesota. So those are the areas that I serve, okay? That's really important to know as well. Okay, so the college that I chose to go to, Options for Animals, College of Animal Chiropractic, was fantastic. I had to go to Kansas. Wellsville, Kansas is where the college was. I decided to drive 6 different trips to the 6 different long week sessions that we had to do in order to do the graduation. So I think it was about 210-hour program in person in 2021 and 2022. And at the end of that was February of 2022, so 3 years ago, I took the test for the IVCA, graduated from that program, and then I also got my certification. So you do not have to be, this is another thing, especially a few chiropractors who have reached out to me and wanted to add animal to your practice. You do not have to be certified in IVCA or AVCA to practice on animals, but you got to look at your state by state by state. What are their requirements? I highly recommend a program because for veterinarians and for chiropractors, I highly recommend an animal chiropractic certification because you are going to learn your anatomy, and you're going to be forced to learn your anatomy more than you did in chiropractic or vet school. You are going to understand and you're going to learn how to motion palpate the dog and the horse. I also work with other animals now, but that comes with practice. Hogs and sheep and cattle and birds. You start to translate your skills and your delicate hand work over to those smaller animals as well. And I see actually quite a few cats here too, okay? And so basically when you're looking at 2 different schools of thought in the United States, it's IVCA certification. Vets, in my opinion, veterinarians like to know that I'm certified, okay? I'm licensed and certified. They trust that I know what I'm doing. They trust that I'm going to take the best care of that animal that I can. And that's why I maintain my certification and my licensure. I'm just, again, not just any chiropractor practicing on animals. That's very important. If I could slam everything home on this video today in a very compassionate, kind-hearted way, that not all chiropractors can see animals. Because they haven't had training, and legally they should not be working on animals because they don't hold a license to do so, which I do over here in the state of Minnesota. Dr. J's group, Dr. Petra's group, Dr. Clayton that I'm talking about, they teach with the animalchiropracticce.com. They have great in-person seminars and they have some online training. Most of those doctors that are instructing us are both IVCA and AVCA certified. The AVCA exam is offered once per year. I'm considering taking it because I would just love to have all of my I's and my T's crossed, because there's always laws that are going to be changing in this work, you guys. Okay? What do I mean by that? When I go to seminar and I get around a lot of like-minded individuals, a lot of other animal chiropractors like me that are human chiropractors as well, it's really important to know that there's other ways of practicing. There's other ways of staying on top of things as well. So the AVCA exam is offered, I think, in September every year. It's another American Veterinary Chiropractic Association. It's just another certification that animal chiropractors, which again are either vets or chiropractors, can be certified. Okay? Let me pause here for a moment because a thought has come in for me. Lay people cannot do chiropractic on animals. Okay? They might call it chiropractic, but it's not chiropractic if they're not a veterinarian, or B, a chiropractor like me. They might be offering body work or massage or PEMF or MagnaWave in different modalities, but if they call themselves a chiropractor and they're not a licensed veterinarian or a licensed chiropractor, they are not a chiropractor for your animal. So this is where the myths come in. Chiropractic is not this term where it's just body work. Chiropractic is as distinct. It'll even talk to you about that in these brochures when I send them to you in the links below, or if you need an actual copy. Chiropractic is a distinct, separate profession, and colleagues of mine were working on making sure that it is such. It is a distinct, separate profession as well as an integrative part in the veterinary world, okay? So again, chiropractors, we work with the vets. At least in Minnesota, I require a referral, a signed approved referral in order for me to see your animal. I need to make sure that that animal's been vetted, especially if there's been a trauma. I don't want any infections or, broken bones, or honestly, I don't really even treat anybody that has cancer on the animal side because it's too much of a risk depending on if there's been metastasis and where that has spread. So I work with the vet's referral, and I won't accept anything otherwise. There's been a few cases where I've actually had to, reschedule an animal because we were waiting on vet referral. And I usually now have realized that I don't book anybody until we have an approved vet referral. I can't always assume that a vet's going to refer a case. And the vets are so busy in our FM community. I need you all to know that. As an animal owner myself, it's really hard to get into your vet when you have an emergency. We have to be grateful for our Red River Emergency Vet Center here in Fargo. Grateful for it. We're the only one in the state. And the next available ER, I would believe, is in the cities, Minneapolis, St. Paul area. So we are really, really fortunate to have that facility here. And I hope that most of you understand that on the small animal side. I don't know much about the AVCA exam. I do know, again, that it's my colleagues have told me that it's once a year. It's going to be a lot like what we did. The test is really hard, you guys. The test that I took was pretty hard, and the written, and I passed, of course, but it took a lot of studying, and I studied with my colleagues, drinking coffee till 2 a.m. the night before, and it was a hard test. I've been out of college at that time in 2022. I had been out of Palmer 14 years, and I had to test pretty rigorously and then have a practical with a dog and with a horse. Actual dog and horse practical in front of these instructors, and some of these instructors flew over from Germany to test us. And again, this was in Wellsville, Kansas, Options for Animals College of Animal Chiropractic, where I graduated from. It's an incredible program, and it's if you want to be an animal chiropractor, you either go to, in my opinion, I'm going to say the two schools, Options for Animals or Parker College of Chiropractic in Texas. And I believe Parker offers I think there's a couple more animal chiropractic schools, you guys, but if you're a chiropractor or a vet listening to this, connect with me. I would love to tell you more about my experience at Options. I think it was an incredible experience, and it's what you need to move forward with your profession as an animal chiropractor. My colleagues that have went to Parker, I would love to connect with more of them too and ask how their experience was. And I know quite a few of you practicing in Texas. I'm thinking of a few right now. Dr. Katie, you're down there. Dr. Rhonda, you're primarily working on equine. I have great connections with, well, like I said, when you go to these wonderful continuing education programs, you stay connected with your colleagues, veterinarians and chiropractors doing animal chiropractic, and we're in it. We're in the practice. We're in the arena. We're getting dirty. We're dealing with the issues that come with taking on animal patients. We're dealing with growing two practices. I have a human practice and an animal practice, and they both have grown since I've started, which of course most businesses should. And adding the animals has been the biggest blessing, absolute biggest blessing of my life. And along the way, I even got my first horse, Brigadier. My dog Norbert comes to work with me every day. Life has changed a lot for me since I've started my animal practice, in a good way. Some ups and downs, some big ups and downs along the way. But I think I finally have figured out what works best for me being a human and animal chiropractor, including how, scheduling, getting intake forms done and vet referrals done, how my Monday through Friday looks, and all of that. Okay. I would love to be sharing more and more videos of me adjusting dogs and horses, and that is to come. But I also want people to know that it's a very intimate session when I work on an animal. It's not something that I love to just shine and show videos of all the time. I do have videos of me adjusting my horse Brigadier in small little clips to show people. Otherwise, the whole adjustment does take about 30 minutes to work with a horse. And to be honest with you, it can kind of look like you can get a little bored after maybe a few minutes of me working while I'm really in tune with the animal. It's fascinating to watch, but at the same time, it's better to be done in smaller clips. So I'm going to do more of that as well. And my drchristinacraft.com will lead you to my Instagram, my Facebook, and my TikTok, and YouTube. All Dr. Christina Kraft. I have them all the same, my handles, to watch more videos and clips of not only of me adjusting, but my journey along the way with my horse Brigadier, animal chiropractic for people, and really my things that I'm up to in my world. And a lot of my world is animal and horse world right now. And I'm trying to always educate and get involved with more networking. And I do have some horse workshops that I'm going to be a part of this summer that I've been asked to demonstrate and speak at and show my work at, which I'm super excited about. And then I'm hoping to train with Dr. J's crew in May of 2025, which I need to get registered for. I'm not going to lie. I need to get registered for. The sun's coming in my window, but we should be fine. Okay, so I'm going to be, again, putting the digital links to this brochure down below. What is animal chiropractic? Okay, congratulations, it says. You have found an IVA certified animal chiropractor. That's Dr. Kraft, okay? Dr. Kraft is an IVCA certified animal chiropractor, which means, no, I'm not a vet and I don't have to be one to actually practice on animals. But the state of Minnesota requires a vet referral. If I do get a declined referral for your case, I can't see your animal. Okay. And then there's other ways that I can refer you to other certified animal chiropractors in our area, whether they're vets or chiropractors. There's just not many in both vet or human chiropractors that are licensed. I think I'm the only human chiropractor licensed and certified in animal chiropractic in our area. If I'm not the only one, please comment below. Okay. I do know that one of me moved away a couple years ago. Dr. Sam. So she's not in our area anymore, and she's a friend of mine. She's moved on to Montana. She's not here anymore. But we need more of me, vet or chiropractors who are certified in animal chiropractic. So we need more of me. I can only take care of so many patients per week. I'm part-time human, part-time animal, which is a full-time week for me. So we need more of me, and I'm highly encouraging young men and women to go to vet school and do that route maybe, or go to chiropractic school. That's your first step. And then you get certified in animal chiropractic through the IVCA or the AVCA. Okay. So that's really, really important. And then there are other animal chiropractic certifications. okay? But I'm really focusing on the IVCA and the AVCA because that's all I really know about, okay? The IVCA is the International Veterinary Chiropractic Association. It's the leader in global expansion of the animal chiropractic field. It sets high standards for postdoctoral education, certification, and professional conduct. That's really important. That's really, really important, okay? The IVCA program is chiropractors and veterinarians, and we follow a strict code of conduct while delivering the highest level of animal chiropractic care. What is animal chiropractic care? Animal chiropractic care complements and does not replace traditional veterinary care. Working together, we offer a comprehensive approach to your animal's health and well-being. And I really love working with vets who refer difficult cases to me, and it's incredible the results that I have seen working together with vet medicine and chiropractic. So the next thing, animal chiropractic is a non-invasive treatment that provides precise manual animal chiropractic adjustments, and that's the key, manual. I do use my hands for almost 99.9% of the animal chiropractic work that I do. I do have a little activator tool that I use for some feline and some canine care, but it's with my hands. I predominantly working with my hands. I'm trained with my hands on humans, and I'm trained with my hands on dogs, cats, horses, cattle. Okay, it's hands-on. It's very important to know that the type of chiropractic that I'm doing is utilizing my body and my hands to do the adjustment, okay? It's a precise manual chiropractic adjustment to correct biomechanical issues specific to the animal's spine, okay? Next thing, these specific high-velocity, low-force adjustments directly impact the nervous system by reducing interference and enhancing overall function. So it's really important to know that high velocity, that means speed, super fast, but low force. So it's super fast and low force, so it's fast and gentle. Chiropractors who are slow and hard, that's not going to work for the animal chiropractor, okay? You have to learn the technique. That's why I highly, go to college to become an animal chiropractor. Don't just use what you think you learned from chiropractic school and translate that over to animals. You can use just activator. There is other schools of thought out there, veterinary orthopedic manipulation. That's a whole nother school of thought that I have some background in as well. I've taken a couple seminars here and there over the past with that. That's utilizing more tool type of adjusting. That can be very beneficial as well and help a lot of animals, but I use my hands, okay? I want people to know that the type of chiropractic I do for humans is hands-on manual, and the type of chiropractic that I do for the animals, including the big horses, even the Belgian crosses, is hands-on, okay? All right, IVCA certified animal chiropractic practitioners are trained to identify and correct, with the adjustment, vertebral misalignments called the vertebral subluxation complex through specific manual animal chiropractic adjustments. This is the benefits. Nerve function is enhanced, allowing more effective communication between the nervous system and the rest of the body. The animal chiropractic adjustment supports the animal's innate healing ability, allowing the body to regulate itself more effectively. A really great example of this is a dog comes in, a Bernedoodle comes in, they have back pain, maybe some limping, but we are also going to help their anxiety. I've seen it, been there, done that, okay? Chiropractic is incredible for those anxious dogs, cats, horses as well. And I even worked on a new Appaloosa cross yesterday, and I already can tell you that horse is already going to have a much better transition into its new home because he got adjusted, okay? I've got so many more cases that I can talk to you about, but we're going to really focus on getting through this information, resulting in improved well-being, boosted immunity, that's huge even in humans, and improved recovery, promoting optimal health and performance in your animal, okay? The vertebral subluxation complex, if you're a chiropractor, you know exactly what we're talking about. If you're a veterinarian and you're listening to this, the subluxation complex is maybe a little bit different from what you're taught in your vet medicine school. The chiropractic subluxation, we're talking millimeters of fixation or misalignment of joint spinal vertebrae. Okay, I'm going to keep it real simple. Instead of me really aligning your animal, I'm actually unlocking their fixations. It's easier for me to explain to an animal owner that I am unlocking the fixations versus, putting their joints back in place. So instead of thinking of me of putting you into alignment, I'm just getting your fixations cleared out with gentle and specific adjustments, human or animal. Okay, so for the vertebral subluxation complex, we call it a VSC, or we can just call it a subluxation to keep it short. It is a misalignment or abnormal position of a vertebra within the spinal column. We're talking millimeters of misalignment or fixation, improper motion, okay? It's nothing, we're not moving an animal a half of an inch or 2 inches when we put a force in them. We're only putting a small amount of force in. The nervous system of a baby, a human, an animal is very delicate. However, I will use more force in a horse than I would in a cat. Kind of would make sense, right? If a subluxation is left uncorrected, it can disrupt the musculoskeletal system, connective tissue, and nervous system, comprising the body's ability to function optimally. Reducing or correcting the subluxation or subluxation pattern in an animal will support the animal's innate healing ability, promoting optimal health and performance. So the subluxation can lead to, this is why we adjust animals, can lead to pain or mobility issues, can lead to reduced performance, can lead to reluctance to certain movements, climbing stairs or jumping, discomfort when lifted. This is specifically probably for the small animal. Undefined lamenesses or gait changes, that's huge. All of a sudden your horse comes up lame and you don't know why. You've looked at their feet, they don't have an abscess. Did they train hard at a show a couple days before? It's probably something in their musculoskeletal system. Chiropractic can help that. Could it be a lot more things? Yes. Okay, but chiropractic can help them. Increased sensitivity to touch, lick granulomas on legs or paws, especially in your cats and dogs. Recurrent ear and anal gland infections are a symptom, right? The body's expressing a symptom because it's trying to tell you that something's not right, okay? Lick granulomas could be allergies, could also be nerve pain, could be a sign of subluxation in and around the area, maybe at an elbow, maybe in a wrist, maybe in a phalange or a toe. Could be something going on in the spine neurologically. They could get an adjustment that could help them. Can it cure it? No, maybe not. That's why the vets need to come in and give their medicines as well. Ear and anal gland infections need to be dealt with properly with the vet and with maybe some medicine and maybe natural remedies too if your vet does those types of things. But that's a sign that dog's got something going on in its immune system as well. So chiropractic can help those things. We don't ever claim to cure anything with chiropractic whatsoever, but a recurring ear and anal gland dog is a sign that dog's in trouble and it needs some help from the inside out. Maybe a dog nutritionist, maybe a dermatology vet, so there's a lot of different people that I can send those people to and educate them to get to the right vet, get to the right professional to help those types of situations as well. Okay. In a dog, altered sitting posture, preference for one side, or we call it puppy sitting, and digestive or urinary issues. So a constipated cat or dog, get them adjusted. Get them to the vet too, but get them adjusted after that. Great cases that I can tell you about removing constipation in dogs and cats in my practice. Common causes of subluxations in the animal. Again, this handout is more for the dog, but trauma or falls. Delayed post-operative rehabilitation. So let's say you've had an operation of some kind and you don't do any rehab. That's a sign the body starts to get fixated. Just like if you were a human and you had an Achilles tendon surgery and you were in a boot and wearing crutches, you're going to develop vertebral subluxations and probably some dysfunction, which then leads to discomfort and even migraine headaches if you're not put into alignment again or removing your fixation in your subluxation. So another common cause of the VSC is anesthesia or medication-related issues. Absolutely. This is a big one. I don't spend too much time on it. It can be quite controversial. Painkillers, drugs, narcotics that animals are on. Too often, even something like Banamine for horses, if we use it too much, it can actually create a vertebral subluxation complex somewhere in and along that body. I have yet to really feel what a horse would feel like on a lot of pain medicine. Most of the horse owners around here try to be a little bit more natural with a lot of that I'm aware of. They don't throw a lot of the pain meds at their horses unless if it's really needed for their arthritis and things. Specifically before farrier work, they might use some anti-inflammatories and things. But just know that if your animal is on a lot of medications, prescription medications, or has been under a lot of anesthesia in a year, like for dentals and for different surgeries and things, they need to be checked by the chiropractor, by the certified animal chiropractor. Why? Because they're probably jacked up somewhere from being under all of that stress to that nervous system. If you have more questions about that, I'd love to talk to you more about that as well. Another common cause of subluxation is specifically in the dog is prolonged crating. Horses would be a long trailer, maybe long trailering, okay? Difficult birth. In the human, the first subluxation happens at birth. In an animal, it probably does too, especially right now. We got foaling and lambing and different things going on and calves dropping. If something doesn't seem quite right, reach out to the vet first, reach out to the doctor of chiropractic or the animal chiropractor like me. And I would love to come check out a foal that is not quite maybe moving well, maybe not quite sucking well. Puppies, same thing. I can do some real gentle work, and that might be where I get my little activator out and help that little guy or boy or girl out in those things. And lack of exercise is another common cause of vertebral subluxation complexes or fixations in that spine, leading to pain, leading to biomechanical dysfunction in, let's say, the neck, the shoulder, the hips, the low back, especially in humans. Lack of exercise, I would have to tell you, is probably the number one reason why I see patients in my practice. So you're going to get prescribed walking if you are going to be my patient here, or yoga or some hula hooping or something. You're going to be prescribed to get moving here. It's important to do so even for our animals. When to seek chiropractic care, musculoskeletal trauma. Okay. Remember, if it's a spinal trauma that is, really bad, vet first, always. Okay, chiropractic comes when the fire's put out. Spondylosis, cauda equina syndrome, that's where the rear legs are kind of maybe not working like they should. That's also a vet emergency too. If you're losing bowel and bladder and you're having problems with vomiting, those are vet-related issues. You need to be cleared out, ruled out for cancer, ruled out for fractures and infections before you can come here. I'm not going to take a case that hasn't been properly vetted based on their history. Okay, that's really important for me to explain. Cervical vertebra syndrome, so a stuck neck vertebra in the horse can also lead to lameness in all four limbs. Same in the canine. So if you've got a rear leg lameness in the wiener dog, guess what? It's not always just in the lumbar spine that the problem could be in. It actually could be up in the cervical spine. It could be C5 anterior. It's a whole nother thing. Get the animal adjusted by a certified animal chiropractor, okay? Discopathy, so disc issues, that can be another thing that we can help with as well. Lick granulomas, we talked about that. Constant licking can be a sign of other things, but oftentimes there's something going on. The dog's trying to tell you something hurts where they're licking. Maybe it's something to look at by the chiropractor. Recurring infections, hip dysplasia. Let's talk about that real quick. Hip dysplasia, first and foremost, if I have a case and I get a consultation call about a hip dysplasia patient, I will typically make sure that animal goes back to their vet and gets some x-rays done. If they have never had them done, I would like to see x-rays before they come in. I want to see what grade they are. I want to see some vet records on what's the grade of that hip dysplasia. The hip dysplasia is basically, this is not hip dysplasia, this is hip dysplasia, where the actual femur head is not tucked in nicely into the acetabulum of the femur. Dog can live a great life with hip dysplasia, but they might have some mobility issues. I can help that. Might not be able to help this, but I can help the rest of the structures, the pelvis and the sacrum and the lumbar spine move better. Oftentimes, if the hip dysplasia is if it's really bad, they require surgery. Okay, so chiropractic, it depends on the case, but I usually like to see x-rays on those. And vet referral on hip dysplasia, absolutely a must. I'm not gonna mess around with a dog that, we don't know for sure if it is. Let's for sure know that we have a hip dysplasia diagnosis before you come here, okay? Arthrosis, so we've got arthritis, some changes in the spine where you're getting bony bony prominences and different things, some arthritis and spondylosis. Those are the things we can help that. We can help enhance performance, preventative care for overall wellness. So that's predominantly my practice. I see prevention care and wellness patients probably every 8 to 12 weeks for a wellness visit. Acute cases, I usually see them 4 to 6 visits a week or 2 weeks in between the visits. And then as they progress and get better, we just space them out. Right now, most of my dogs that come in for wellness are either at 8 or 12 weeks. Okay, if people wanted to know that. Horses, right now in the wintertime, most of my horse owners are wanting every month, but right now we're going like every 8 to 12 weeks because it's been so cold and all of that. But most horse owners that are using their horses in the summer are going to want that adjustment every month. Okay. Whew. All right, that's a lot of things that I talked about there, and I inserted a few of my cases in there and told you a little bit of my experience in there as well. But I want to pop back before I end this video today about a recent case that was, I recommend that you book a consult call with me. It's called a 15-minute Animal Chiropractic Phone Consultation at drchristinacraft.com. What happens is then you book a call with me. You are going to, in your email through this whole system, you're going to get an email that's going to have you fill out information for your animal, dog, cat, horse, okay? Then I'm going to call you at the scheduled time, and we're going to talk about your animal. And I had a recent case where we had a canine that needed chiropractic care. We maybe had a little kink in the neck. And I said, okay, great. I think this dog is a great case for a great candidate for chiropractic care. I'm going to send off for vet referral, and we'll get you scheduled as soon as possible. Well, unfortunately, and I'm not going to name names, that vet did not refer the case and declined the case because I'm not a veterinarian, is what I was told through the client. Sometimes I'm not always directly communicated with by the vet clinic. Oftentimes I might fax a vet referral. I'm going to email. We'll get an email back. I'm at least trying to minimize taking more time out of my vet's day and their vet tech's time. I'm trying to make it as simple as possible, not only for the vet, but also for the client to get the animal scheduled with me. And I was upset about it only for a short while because there are other animals I know that I need to help, but it's oftentimes they don't refer because I'm not a veterinarian. Okay? I want my clients to know, all of you that are watching this, I am licensed and certified to do this work. I do not have to be a veterinarian to do this work. However, in the state of Minnesota, the rules are that I require an approved referral in order to see your animal. And that's exactly what I told that client. And in fact, that vet referral decline was the reason why I wanted to do this video and put out more education around what animal chiropractic is and what it's not. And we work together with your vet. But in the case that I do get a referral that is declined, I can't see that animal. Patient owners of the animals can go to another vet clinic and get a wellness exam and get a referral maybe from another vet. I'm not going to rush to tell anybody that. I will offer that as an example of what you can do. You can maybe get to another vet and get a referral from them. I will send them to another animal chiropractor and give them the give them the verbal referral. Can you try this person, try this person, try this person. And again, if there are other licensed and certified veterinarians and chiropractors doing animal chiropractic in the Fargo-Moorhead community, please put it in the comments below, because there's probably new graduates all the time, and I'm trying to stay abreast of who is available for me to send patients to. Now, if you're a veterinarian, you don't need a referral, okay? If they're a veterinarian who's practicing chiropractic, they don't need a referral. They're a vet. Their primary patient is animals. My primary patients are humans. That's why I require a vet referral to work on your animal, okay? And I take that very seriously because I've worked so hard and I've gone to school for so long, and I've had to spend so much time and energy and finances to go to college for animals as well as for humans, that I want to do everything right for myself and for the animal. And I really love having a referral because that tells me that the vet trusts that I'm going to do a really great job with their animal and their patient, because primary animal doctor is the vet. I'm kind of borrowing their patients for chiropractic, okay? They're my patients too, but their primary provider is the veterinarian, okay? So with that being said, in my practice, I have some wonderful handouts. I also have this canine nerve function chart that shows you how all of the spinal nerves and all of the spinal vertebrae, are affecting the different organs, tissues, and joint structures of the body. That's a wonderful one. I would love to find one for horses. I haven't done that yet. Inside these brochures is just wonderful things about even some for horses in here. Understanding, different disciplines your horse is doing will cause different issues. Same thing, why would we see a horse reduced performance, abnormal posture, snapping and pinning back the ears when being saddled, or what we would call cinchy, insubordination when being ridden, the attempt to free itself by throwing its head back or by hollowing the back, swishing its tail, pinning back its ears, that's a sign of maybe some discomfort. Disobedience when jumping, difficulties with collection or lateral gaits, changes in behavior, frightened or painful facial expressions, and sensitivity to touch. If there's subluxations found in your horse, it could be causing abnormal gait rhythms. It could be causing the need for chiropractic. If you need chiropractic, irregular gaits, stiffness when the horse leaves the stable, stiffness when bending in its general posture, muscle atrophy. I've seen that quite a bit. Brushing and interfering, a pushy horse too. I'm going to just say it here. A pushy horse, yes, there could be some behavioral stuff there, but they're probably also trying to tell you something, that they're in discomfort. Difficult working long and low, shortened stride in one of the legs, one or all of the legs, or one or more of the legs. Overall decreased range of motion in the gait. Difficulty flexing the pole. The pole is the most common area that I adjust on a horse. Lameness. That's a pretty obvious reason to get checked. Horse pulls against one rein, not riding evenly, balanced. Rider is seated off center due to the horse or the back does not swing. And I love seeing not only horse, but I also love to check the rider. Not only do I love to see the dog, I love to work with the animal owner here, because the healing, expressing the innate intelligence through releasing that vertebral subluxation should happen for both the human and the animal, in my opinion. So I love being a companion animal helper, and I love to help the humans. That includes the babies to the seniors. Okay, so with that being said, a quick summary of this session today. Chiropractors, if you are practicing on animals in the state of Minnesota and you are offering chiropractic, I'm not going to say watch what you're doing, but kind of watch what you're doing. People might seek you, but if you're not licensed and certified, you might be at risk of losing your human license. And I take that seriously, because I'm one of those doctors that has gone to college for animal, graduated, and has whole licensure, and we pay all these different fees and continuing education to do this work, and we're licensed professionals, that it's really important to follow the rules in your state, depending on your scope of practice. So if you're a human chiropractor practicing on animals in the state of North Dakota, there really isn't any rules and regs over there that I'm aware of. And I used to live in Bismarck, and I'm from the Minot area, and I live in Fargo. But with my licensure and I'm up to date on all the things from Minnesota, I follow the Minnesota's rules, which includes that vet referral. Okay. Again, if you're a veterinarian, you don't have to have a referral for your patients for chiropractic. Or if an animal chiropractor, if a veterinarian is certified in animal chiropractic, they don't need a referral. All right, they can practice on your animal. So that's another reason why a lot of people will seek out veterinarians who are chiropractors. For a lot of that reason, there's just less steps to do. But my form is so simple. The vets just sign that, and then I can schedule your animal. Okay. I hope I busted some myths in this hour nearly that I've recorded. I'm taking a break from a couple I have a couple more pets to see after I'm done with this video. With that being said, in the comments below, I'm going to put a couple of links to digital brochures. One's going to be more for the dog and cat, canine mostly, and the other one is for the equine chiropractic, and you can share that with your friends. So what else can I say? I would say the most common case that I have right now with Canine is the geriatric dog. Okay, they're stiff, they're sore, they're not moving like they used to. I see a lot of dogs that are old timers here, and that includes like, Labs, Great Danes. I see wiener dogs. I see Dobermans. They're getting older. Any breed is welcome here. Again, I do require that you book a consultation call with me first so that we can make sure that Animal Chiropractic is the right choice for your animal. At drchristinacraft.com, you're going to see services for animal and you're going to see services to book for human. You don't need a referral to see me humans, okay? That's another thing I think a lot of people wonder about. Absolutely not. I can see you the same day. If I have an opening at drchristinacraft.com, you can schedule. You can call or text 218-789-1811. That directly is my business line. It's not a private cell phone. It's a direct business line that'll come right to my screen and right to my phone. But just know that that's not a private cell phone. That's a business line that you can text for business purposes, human or animal chiropractic, or if you need products, humans. I do offer a couple different product lines, including essential oils and health supplements for humans, not for animals. What else can I say? There has been more need to educate, which is why I'm doing this today. And I feel that maybe I will also be recording more of me adjusting different types of animals in smaller little clips. And even including me adjusting some humans and seeing the adjustment session, seeing the flow, seeing the connection before the correction. We don't ever rush a chiropractic adjustment for human or for animal. It's a very delicate service, a delicate session. It's a very sacred thing to do the adjustment on a human or an animal. And so it takes time. That's also why it's important to know that when you do hire a human chiropractor or an animal chiropractor, let them help you by giving you a little bit of time in your session as well. I don't know about you. I get adjusted often, and my chiropractor takes about 20 minutes per session with me, and it is the most incredible 20 minutes of my week or my month whenever I go. I usually go twice a month, and it's an incredible, not only for my body, but for my mind and my spirit to get that adjustment done and to have that conversation with that practitioner. It's game-changing for my own physical, mental, and emotional health and spiritual health as well. And that's what you're going to get when you work with me, is you're going to get an experience that will help transform you and your animal, not just from a physical perspective, but I'm really hoping to help educate and to help people transform the way animals, maybe not so much, but the way the people, how you're thinking about your body and your health and things, and how you can kind of translate that into what changes that you need to make outside of the office. And when it comes to animal owners, what is it that you're seeing in the changes and the results in your animal that you also want? So I would love for you animal owners to get on my table as well and get adjusted. If you haven't been getting adjusted, get adjusted, okay? Or if you're getting adjusted by another chiropractor, great, awesome. That's what I want to hear. So if any of you have any questions about this content in this video today regarding the IVCA, about animal chiropractic, about options for animals, College of Animal Chiropractic, about animalchiropracticce.com with Dr. J, Dr. Petra, Dr. Clayton. If you have an animal that you might want adjusted, reach out to me, drchristinacraft.com, call or text 218-789-1811. And I thank you so much for joining me today, and I will see you on the next one.